One resource that I love to tell people about that I think a lot of people aren't aware of, Intermountain Healthcare has what they call access centers. And I think the name isn't super descriptive, but they're basically InstaCares for mental health. You get rapid access to mental health. We have locations at McCady Hospital up in Ogden, and that one's open 24 hours. We also have access centers at LDS Hospital and at St. George Hospital down in southern Utah. We are working on getting one in Utah Valley, but that might be several more months before it's open. But that's one thing that I think is really awesome that a lot of people don't know about. Right now, if you need rapid access to mental health, unfortunately, going through the emergency department is what a lot of people end up doing, because there is not a better way in some areas. What's cool about the Access Center is that it connects you with resources that are just for mental health. And that way, not only are you getting really, really specific help for the mental health need that you have, but you're also not tying up precious emergency department resources. So they're really cool. They're mostly for adults, but I think that they can connect you with resources for kids as well. Another really cool resource through Primary Children's for the mental health, they call it ARCS, and that stands for, it's ARCS, it stands for Assessment, Referral, and Consultation Service. And what you do is you give them a call and they explain what's going on, and they can help get you to the right care that your child needs. And it's one phone number, 801-313-7711, and they can connect you with the specific thing that will be helpful for your kid. For adults who need help navigating what type of resources, Intermountain also has what they call the Behavioral Health Services Navigation Line. Again, trying to get people to the right care at the right place at the right time. And you just call the phone number, it's 833-442-2211, and they can connect you with resources, whether that's within Intermountain or outside of Intermountain. The Live On campaign through Utah, liveonutah.org, has a lot of resources available there. The cool thing, I think, is that we're talking about it more. And the more we talk about it, the more it normalizes that people need help. And I like to think of therapy as like exercises for your brain. Same way you would go to physical therapy if you had like a shoulder injury or a knee injury. Our brain's a pretty important part of our body. And going to therapy is just like trying to have a healthier brain. And there's no shame in that. And I know there's a lot of stigma when people say mental or psycho, but really the way I like to think about, and the way I've tried to teach my kids and my family to think about it, is just having a healthier brain. Who doesn't want a healthier brain? There's nothing wrong with that. We would be so much better off if we all had healthier brains. And there's no shame in feeling sad or saying that you need help. We all feel it. We all need to talk about it more. Getting access it can be really, really tricky, just because there's so much of a need for mental health. And like everywhere, hiring and getting enough people to staff everywhere has been really tough. So I guess the message there would be like, be patient, work with your health insurance to find somebody, and just understand that like there's a shortage and it's tough. And we're working on it, trying to make it better, looking at digital solutions. Kids are on their phones all the time. If they can use that time on their phone to get therapy or help or use a mindfulness app, we're just looking for any kind of help that we can get until somebody can get connected with an actual person. I think there's also an opportunity for us to just be kinder to one another and more patient with one another. And you just never know how far-reaching such a simple thing can be, to be kind with somebody who might be struggling with things that we don't know about. We're all struggling with something, and if we can all just be kinder, that sounds kind of dumb and cliche, like, can't we all just get along? But I really think you never know what somebody's going through, and small interactions can have big consequences one way or another. And there are a lot of resources out there if you go looking, and don't be afraid to talk about it, because navigating this stuff is hard. As an adult, seeking your own services or trying to be a parent and finding resources for your kids, it's hard. We're trying to make that a little simpler with those phone numbers.